Mental health services right now are being funded by local property taxes, but a new bill recently passed by the state Senate would change that. KCAU-9 News reporter Mallory Smith explains.
The importance of taking care of your mental health has become a well-recognized need. And now Iowa lawmakers are working to make those services more accessible and of a higher quality. The Iowa Senate recently passed a bill that would shift mental health funding from county property taxes to a fully state-funded system.
We're hopeful that it's going to have a very positive effect. We've been encouraging the legislature and the governor to make a state investment in the mental health system for years now.
Senate File 619 would eliminate the mental health property tax levy over a 2-year period. That is estimated to save residents nearly $100 million in property taxes and $1 billion in tax cuts over the course of 8 years. But Teresa Baumhoff with Mindspring Mental Health Alliance says the bill is a step in the right direction, but that she has her concerns with the quality these state-funded services will provide.
They are trying to make an effort. I'm worried that there's actually 3 types of services that are needed in the legislation. They only talk about 4 services. So is there going to be enough money available to pay for the others too?
With the pandemic, the need for mental health services has only increased. Peggy Huppert with National Alliance on Mental Illness believes the bill means positive change.
We're excited to see how this moves forward with statewide accountability and strategy and equity, because our goal is that no matter where you live in the state, you should have access to the help that you need when you need it.
Hubbard says currently with counties in charge, some end up struggling more than others because certain counties pull in less money in property taxes. But the hope is that with this bill, each person will have equal access to care. The measure now sits on Governor Kim Reynolds' desk awaiting her signature. If you're in need of mental health services but are not able to access them easily, experts recommend telehealth as a resource or by calling the NAMI hotline, dialing 211 on any touch-tone device. It's an easy and free program that you can use anywhere at any time. Mallory Smith, KCAU-9 News.